Everybody, I'm Phil Stasek. I'm the past president of the Space Coast Progressive Alliance. And we would like to welcome you to our event tonight, COVID Cover-Up, A Shot of Truth. We have three absolutely wonderful superstar panelists for you tonight that are going to be talking about truth and the importance of telling the truth in the middle of a global pandemic. We have a fantastic story to be told, and it is one that I hope that you'll stay with us throughout the entire evening. After our three panelists speak, we're going to open the floor, and it'll be a chance for you to ask questions and for you to be involved. Now we're coming to you via Zoom and Facebook Live. Those that are on Facebook Live will have a chance to submit written questions that will be asked of our panelists. And hopefully the discussion will be lively and you'll all be able to take something home from it. We're also going to be asking our panelists to give us an action item. So I would ask them to please start thinking now about an action item, something, one or two things that you might want our audience to take with them at the end of the program, something that they can do to change the community or to make the world a little bit better place. To start off with, we have a few bits of business for the Space Coast Progressive Alliance. First, I'd like to introduce our president, Rayed Al-Shaibi.
Thank you, Phil.
You're welcome.
And good evening, everyone. Hopefully we have a lot of people join us. I know people start trickling in, but I just want to welcome everyone for joining us at our monthly program, the first Thursday of every month. And what a program we have today. We had great programs the past 3 months, and this is a special one. We have a great APC committee, project committees that works on finding what needs to be discussed in our community. And this is a timely subject. Been waiting 15 months to find the truth about this issue that we're dealing with. A lot of people are suffering from this virus, and we don't know what's going on. There's a lot of misconception. There's a lot of truth that needs to be uncovered. So we have two parts of this program today, and it's great to have Dr. Grayson that's going to speak about the disease that we're dealing with, and we have two wonderful people, Rebecca Jones and Alessandra Sassoon, who will talk about some of the things that we have been covered. Politics are involved in a lot of these areas. So I want to thank again our APC committee for bringing this to us this Thursday. And just want to remind everyone, this Space Coast Progressive Alliance, depends on your contribution. We want you to be members. We have great membership. We have a lot of followers, and it's very easy to join. If you can visit our website, we have an updated website, www.scpaflorida.com. You can, click in there, join. It's only $25 a year. Just small pennies, but we'll keep us going and keep us engaged with the community. So I want to send it back to Phil. I think Phil, you're going to introduce these wonderful speakers. And before I send it back to you, I just want to also remind you that the following month we already have a great program in planning. It's going to be on April 5th, View from the Sky and at Home. Just another wonderful program. We have surprise speakers. I heard that there's an astronaut that's going to join us, so I can't wait to listen to that one. But for tonight, just stay tuned. There's a great three speakers, and I'm just going to say, Dr. Grayson was with us last January and spoke about this issue that we're dealing with. A lot of people took it for granted, and we're still dealing with it. So hopefully we'll have some answers tonight. Back to you, Phil.
Thank you, Rayed. The purpose of our event this evening is to look at this bizarre circumstance that we're in. Our planet is in the midst of a global pandemic. People are dying by the thousands every day. Even now, many people think because of the vaccine that we're on free and clear and we're on the other side of this, and that is not true. But over the past year or so, we have found a point where politics and science have crossed. Our reaction to our response to the pandemic should have been led by scientists, but in fact, politicians began interfering with the work of the scientists. And we know through public records release, we've heard Donald Trump, the former president, actually telling a reporter that he was lying to the public. He admitted, and we all heard him say it. We've already seen Dr. Birx, Dr. Fauci publicly admit that there are mysteriously multiple sets of data that were being released to the public from the White House. This is a time when truth saves lives. Over the past year, thousands of people have died unnecessarily because they were lied to, not only at the national level, but also by our state leaders. The case of what has happened in Florida is something that I think many people don't know the true story of, and that's what we're going to be learning tonight. We're going to hear a shot of truth from each of our speakers. First, we'll be hearing from Rebecca Jones. She's a data scientist. She's the founder of Florida COVID Action. She was leading the information release on the data about the coronavirus in Florida when somebody was trying to push her to change the data, to change the numbers, and she pushed back. She did not want to be in the spotlight. She did not want to wind up on the front page of the newspaper, but circumstances have drawn her there, and she'll tell us her story. Alessandro Sassoon is an investigative reporter for Florida Today. He has served around the world as a reporter and been in some very interesting places. And this is a story that I think has been exceptionally important to our state as he revealed and told the story of what happened to Rebecca. Some of you have probably seen the images on television of the Florida Department of the state police essentially serving a warrant on her, coming into her house with guns drawn, and shocking images with children in the house. And anyway, Alessandro can tell how the story developed, and very much looking forward to that. And as Riad said, Dr. Grayson has been our shining star. She's a good friend and one who told us more than a year ago what was going to happen. She told us that she didn't have a crystal ball. She couldn't be certain. Coronaviruses have been around before, but she warned us. She warned us about the importance of masks and face shields and how the virus could be transmitted and the way that it would build in waves and then kind of go away and come back again. And then all around our country, we would see brush fires. Dina can tell us tonight about her view as a scientist, a medical doctor, a virologist, a researcher, somebody who honestly knows more about, whenever you walk in a room with Dr. Grayson, you know that she's the smartest person in the room. So let me just leave it at that. I could read their biographies, but it would take up half the night. Each of them are superstars. So I'm going to sit back for a moment, and I think all of us should listen carefully. In fact, before we start, let me remind everybody of something, and that is those of you that are on Zoom, on the bottom of your screen, there's a little function. I think it says reactions, and it gives you the opportunity to raise your hand. When our Q&A portion begins, which will be after the third speaker finishes, we'll be asking you if you would like to ask questions. And that's where you'll go to raise your hand in the little reactions window. Just raise your hand. We'll be looking for you. We'll call on you. Otherwise, we're keeping everybody muted so that we don't have crosstalk. So remember, when it comes time for Q&A, look for the little reactions button, raise your hand, and we'll call on you. And along the way in Facebook Live, please, if you've got a question, you can just write it out, and hopefully we'll be able to forward your questions on to our speaker. And now, our first speaker, Rebecca Jones, data scientist, founder, Florida COVID Action. Rebecca, welcome aboard. Please tell us your story.
Hi, thank you guys for having me. I'm sorry that I'm like super overexposed with the light, but I don't know how to adjust the settings. So I just had to bear with me a little bit. But I keep getting asked to tell my story. And one of the strange things is that my story is Florida's story. We moved in lockstep. I had an insider view for the first 5.5 months. And then afterwards, apart from a couple of sources inside the state, I had to watch everything unfold with everybody else, completely powerless to do anything about it, uncertain of whether or not the data could be trusted, hearing some of the radical and ridiculous ideas like, oh, sunshine will kill the virus. And then Florida had its, July and August, just disastrous peak of cases and deaths. And it was going to go away by Easter. And maybe next Easter, maybe that's what he meant. I don't know. But it was really difficult to try to navigate data in this circumstance. So we had a lot of it. A lot of it wasn't great. It was poorly collected. It was being submitted from all over the state with minimal standardization. And there were a lot of caveats to it that I always tried to make as clear as possible. But it was one of those situations where you have to use what you have, for me, at least, when I was designing the data systems. And that became kind of my focus, was to make clear what we had and what we didn't have, and how it should be used and how it shouldn't be used. And as we were releasing more and more data, there became things that weren't ideal. So when President Trump said that he wanted all states to release case and death data by race, we decided at Florida to only release Black, white, and other, which I vocally opposed several times because there's more races than just Black and white. And we know how disproportionately some of those races, especially Native Americans, have been impacted by this virus, but we didn't want to get that granular. And we couldn't add Black Hispanic or white Hispanic. It was two separate things. And we kept all that data though. I mean, we had specific national origins and ethnicities. We had Jamaican, we had Native Hawaiian. We kept that, but we never released it. And I think that's partly because of the person who was in charge, who, when he found out we had to release the data, said it was, and quote, pardon my French, shit data. And the only reason we had to release it was because the press, who he hated, were saying that, it was disproportionately affecting minorities, which it wasn't, which is not true. And this was one of the head epidemiologists on this. He actually made the statement that it wasn't disproportionately impacting minority groups. And I kind of took it back. I'm like, it's like epi and geography 101 right there. And we had to release it anyways. And when we did, I think out of spite, it was Black, white, other. And so there were always things that were slightly uncomfortable. We only allowed male and female. We didn't give the option for, binary or transgender or other. We didn't track to the extent we should have physical disabilities. There was a lot of stuff that wasn't happening, but I did my job. I believed I was doing, within the bounds of what I was assigned to do, the most honest job that I could. And when it came time to start adjusting our own metrics so that counties could reopen, despite our own internal modeling that showed what would happen, although we grossly underestimated how bad it would get. Then again, we didn't think we'd just jump to phase 2 2 weeks after. So, that played a part. I didn't speak up much because there were a lot of policy decisions being made that I felt were out of my area of what was appropriate for me to say. So deciding to exempt all of the rural counties in the state from even having to be considered for the criteria, instead of developing a statistical model that could take into account that we weren't testing very much, which was a problem in the first place in those counties, and try to do it in a way that was defensible. That was my only comment about it, because I'm not in a position to decide how we apply the policy. It's my job to make sure that the data was right and that we were using it correctly. And so push and push and push until I was asked to actually change numbers. And that was my line. And I had seen every subtle change that, by itself wouldn't look that bad, but when you add them up as a whole, creates almost an alternate reality of what was happening in the state. And didn't really stand up for what I now wish I would have at that point. But when it came to actually just lying, using data to lie and changing numbers, which would have required us to delete cases, because if you have our case numbers and when we say, there's this many positive people and this is how we calculated it, you can just look at the cases and see that that wasn't correct. So the natural next step of that would have been to start deleting cases. And I was not willing to do that. And I honestly didn't even take a second to think about it. I kind of laughed in the person's face who asked me to do it, not realizing, of course, that it would send me along this path in that moment. So I was taken off the dashboard after that and was still at the state for a few more weeks while I was trying to help them undestroy it, which is pretty much what they did. It took 6 people to do what I was doing alone every single day, and they still weren't doing it very well. And I was severely underpaid. I should have been making the salary of 6 different people at that point, if that was really how it was breaking down. And I stayed around to help them. And I told my boss, I was like, I'm at least going to stay through the start of hurricane season. I don't want you guys caught off guard. I'll make sure I have all the data prepped, considering COVID and all those plans. And then on a Friday afternoon, I asked him about filing a whistleblower complaint. And the next Monday I was fired. At the same time, unbeknownst to me, Alessandro, one of our other speakers, was working on a story about how I was taken off the dashboard and how there were people who had noticed, people across the state who noticed that something was going on with the numbers, something was going on with the dashboard. I wasn't responding to people because I was getting flooded with emails of why I wasn't working, and it wasn't my project anymore. And I couldn't explain to them what was going on. So in an attempt to make sure that people were asking the right questions to the right people and to subtly, I guess, raise a warning flag, I sent an email out to my data users group saying that, I'm not on the project anymore. This is who you talk to. If you have questions, I can't help you. I can't answer any questions about what's going on. Just be careful, because there's being changes made. And those changes are the reason I'm not on it. And so after I was fired Monday, that night I was driving to meet my parents, who I hadn't seen since their house was destroyed in April in a tornado. It's been a really rough year for us. Our family's been through the ringer a bit. I hadn't seen them since that happened. When it did happen, I was at work and I stayed at work and I didn't miss a second. I didn't go over and help the way that I really now wish I should have. I really should have. I should have just said, the dashboard's going to be down for a day. I'm sorry. I have to go help my family. They just lost their house. And I didn't, because I thought if it just all of a sudden there's nothing there in April, people would be terrified. They wouldn't have any idea what was going on. And there was nobody else to do the job. Nobody else had access to it. And so I stayed and I worked. And for that, I got taken off of it 2 weeks later. And I was driving to finally spend some time with my parents when I got a call from a reporter asking me for a quote. And I had no idea what she was talking about. So I said, I don't know what you're talking about. She was like, well, I'll text you the link. And I clicked on it, and it was a story by Alessandro detailing, kind of what had happened over the last 2 weeks. And I actually begged him to take it down. I was like, I think I even said at one point, I will tell you everything if you just take this down, and I can do it in a non-public way. But he, correctly pointed out that, well, if you're getting calls about it, cat's out of the bag. And he was doing his job. He had a story that needed to be told, and he told it. And after that, everything spiraled out of control. I didn't talk to anybody. I refused all interviews. I actually hid for 5 days as I watched DeSantis defame me and try to say that I had no significant part in a system I designed and a program that I built and scripted and processed every single day alone for months. And which I still have not been paid the overtime for, but a lot of overtime hours I didn't get. So after a few days, I think it was 4 days of watching that kind of unfold and being pushed for days to publicly come out and say, this is not true, which I felt very uncomfortable doing. I decided that I would do 5 minutes with Chris Cuomo. I'd been talking to him off the record, and I felt comfortable with him. And I said, I'm just going to put the focus on the data, because people deserve to know what is going on and who I am and my role, whatever they want to say about it, is irrelevant to the risk that's being posed by those people not getting that information. And so that's what I did. And then after that, I tried to become a nobody again. I tried to, secure the job offers that I had that disappeared after DeSantis smeared me, and just try to be private. And it wasn't happening. My name was out there. There was so much going on. And I was watching everything that our models had shown, everything that we warned about happening day after day through my own dashboard. And I felt like, if they're not going to present everything that's out there in a way that's honest, then I will. And so I built this kind of data system and structure to do that. So I pulled in Department of Corrections data, hospitalization data that DOH never allowed me to put on the dashboard. Hospitalizations, that's one of the most critical elements of surveillance and how we're doing. And we were never allowed to put it on the DOH dashboard. And DEM data and ACA data, all of it. I pulled all of it in. I scraped all their PDFs that they buried data in, like how many cases per city, and LTCF, long-term care facility deaths and cases that they was only available in a PDF. And I made it a searchable list. And just simple things like that we should have always been able to do, but I could never convince them to do. And I did one of the things that I thought was most criminal in not doing is I created a resource for people to be able to find testing centers near them. I worked with the GIS Corps who had been compiling this data and created an app so that people could just open it up, click where they were, and see all the testing areas within a certain distance and whether or not they required appointments or insurance. And with that access, I was able to do something that we should have been doing the whole time. And for that, and for my work with schools nationally, I paid a very severe price. When in December, almost a dozen armed policemen from state police raided my house, pointed guns at my children and my husband, and took all of my computer hardware and external hard drives, and basically anything that was electronic they could find, they took. And I thought that was reflective of the tone towards people who speak out. And of course, now we all know that they were lying the whole time. And we all know that data was fudged, and they were told, the Department of Health officials were told not to even mention COVID in the lead up to the election. And they stopped reporting deaths in the lead up to the election. And of course, now everything with the vaccine rollout that's been happening, and complete corruption and just lie after lie. And it feels sometimes like I'm spinning in a different world because people seem more intent on smearing me and harassing me and attacking me than they are asking just simple questions like, why is he doing this? What is the game? Why would anybody at the Department of Health or the Department of Emergency Management follow in line with this? And I think it's because, I don't know if you're familiar with Celine's second law, but when you have the structural hierarchy, everybody wants to kiss the ass of the person above them so that they're not retaliated against and they're not fired. And I'd worked in climate before this and disasters in general. So I'm acutely aware of how data can be suppressed or twisted or disregarded. But there was a level of aggression and violence in the anti-science movement, I guess, during this period of time that I thought even was unfathomable. And I think I'm still in a bit of shock from it. And I think we all are. And we've all dealt with observing that violence, whether it's the insurrection, at the Capitol and the riots, or watching people die or being sick. I caught COVID in January and it was awful. I thought I was going to die. I really thought I was going to die at one point. And we've all been going through this. So in a way, all the sensationalism and salacious tabloids and craziness that surrounded my story isn't any different from anybody else in Florida who's had to watch this all happen or live through it or not survive it. I still have that. So that is my short synopsis, I guess. There's a lot to it. There's a book's worth that I will finish writing at some point, but really it's been a hard year. Maybe not everybody had their parents lose their house in a tornado. I will say that was probably the worst part of it. Yeah, worse than raid, worse than getting fired and being thrown into the TV, and then having, Twitter accounts set up whose sole purpose is to, harass me and defame me. The worst part was the tornado. And I get to say that was unique to me, but that also happened in Mississippi. So it really isn't part of Florida story. But other than that, it's just everybody's had a rough year. We all just want to move on. And I hope when we do that we learn from this. Because if we don't, then that attitude carrying forward, that disdain for experts, that disdain for scientists and people who do the work, that's going to hurt us in more ways than we can imagine right now. And I guess that's my spiel.
Rebecca, I want to say thank you so much. If we were in a room, you would be hearing a standing ovation right now. When the history of this pandemic is written, a year from now, 5 years from now, whenever, there will be heroes that will stand out in the story. The nurses, the doctors, the aides, the people in the hospital, the folks that have developed the vaccine. But ethical civil servants who deserve recognition, I think, will also shine. People like you who have stood up and done the right thing when it's hard. None of this is easy. When you're a soldier, there are times when you have to make a decision to do the right thing or to do what your boss is telling you. And you're expected to do the right thing. You, ma'am, I think will be singled out as a hero. And I think that as history is written, it will be clear who the good guys and the bad guys have been in this process. We will look to scientists in the future for the truth, and we count on you to be ethical and honest and open, and we thank you for all that you have done. Thank you so much, Rebecca.
I'm really not a hero. I just have to add that. I'm just a person who said no to doing one bad thing and then became very stubborn about it. And my mom will tell you I'm the most stubborn person in the world. I actually started an awards program for the heroes. It's actually Data Hero Awards that we're running this month. And those people, they're all heroes. They're all heroes. We are surrounded by heroes who just don't have 300 and however many thousand Twitter followers, but they are everywhere and they've made a difference. So they look to them. I think
in the end, history will be the judge. So let me predict that I suspect you will be on that list. I would also ask if the audience is wondering, you're still operating the COVID Action website, and how can our audience go to see the Florida COVID Action website?
We're actually winding down. I figure as long as the Department of Health is publishing data, so will I. But we're going to be doing it more limited, but it's still floridacovidaction.com.
If for anybody in our audience, if you have not seen that site, logged on to it as a favorite, or maybe in the past contributed a little to help make it work, this is something that is worthwhile. Definitely a very, very worthwhile place to go get information. So again, thank you, Rebecca. Our next speaker will be Alessandro Sassoon. He is an investigative reporter for Florida Today, our hometown newspaper. And I would like to remind everyone that it's important to support your hometown newspaper. You know, if you don't think that you need to subscribe, I ask you to think again. Because without our hometown newspapers, without good quality journalism, without the investigative reporters, our society is in trouble. We've discussed this before. In fact, we've discussed it probably at every other one of our events, how important it is to find someone who's digging for and revealing the truth about what's happening. Our politicians will run amok if they don't have watchdogs, if we don't have good, legitimate journalists keeping an eye out for what's happening. And our next speaker is one of those good, legitimate journalists. Alessandro, please tell us your story.
All right. Well, thank you for that introduction. And
you're welcome.
Well, my action item there, I was going to say subscribe to the local newspaper. But I'm glad to join this panel. Hello, everyone, and I'm curious to see what questions people have at the end. Yeah, my name is Alessandro Marazzi-Sassoon. I've been a watchdog reporter at Florida Today since June 2019. And before that, as Phil mentioned, I was a reporter overseas. I was in Cambodia for about 3.5 years. So I'd actually only really been living on the Space Coast for about 9 months before the pandemic hit. So it's been frustrating to not have been fully able to enjoy and explore Florida. And I'm, I think, looking forward to that moment where normalcy returns as everybody else is after, as it was mentioned, a pretty rough year. So if we go all the way back to May 2020, when the story about Rebecca Jones first broke, it's really a long time ago. I mean, put in perspective that it's before, George Floyd and the national reckoning on race. So like a lot has happened since then. But the issues with the story for me intersects, namely, transparency and accessibility of information from the state. Those issues continue to be issues. So if we kind of go back in time to sort of March, April, we know now from the records that the state was tracking possible COVID-19 patients as early as January, and had confirmed cases before the first case was officially announced. So this was revealed in reporting by the Herald, but it was also contained in the medical examiner's COVID-19 death data, which me and my colleague Jim Waymer published with Florida Today. And that was after the state had blocked the release of that spreadsheet. And that followed reporting by the Tampa Bay Times about a discrepancy between the medical examiner death count and the DOH. Now, the difference in that count was ultimately based off of the fact that the DOH counts based off of residency and medical examiners count, count based off of where the dead body is located. But what we found was that it was the detailed narratives that were contained in that spreadsheet that were very revealing, and they revealed a variety of early system failures, and some of those issues are still relevant. So, we could really ask, what happened to contact tracing? That was a question at one point, and now, it's still a question, but it's just been overwhelmed by just an avalanche of other questions. So that's all happening in early May. And part of that backdrop too is that newspapers are threatening lawsuits for that data and nursing home data, and the case count is sort of steadily creeping up, and the governor is moving to reopen the state, and he's barnstorming around the state doing presentations, saying, look, we're ready to reopen. He's showing data that says, hey, we're good to go. And sometimes these are poster boards with a line drawn between 2 points to illustrate a trend, which is a detail that the Sun Sentinel later pointed out in their feature on the COVID-19 narrative and spin. So all this is happening. In the meantime, I'm just talking to researchers at various universities in Florida who are telling me, look, how the DOH collects and spits out data is a bit of a black box. To see what's inside, we need these things called data use agreements, and we're not being given those. And all these months later, I'm not aware of any Florida medical school, research group that has a broad DUA with the Department of Health. But at the time, there was a little bit of thinking of, okay, well, the Department of Health is understaffed and overworked. We'll get these eventually. But all these months later, still no DUAs with researchers. But there's the dashboard, and it's accessible, and data can be exported from it, and functionality is being added to it day to day. Will have its like occasional glitch. It'll go down for maintenance, but all these things are being disclosed to data users and explained in emails to a listserv. But when those emails stop coming and the accessibility kind of disappears or changes, people started to get worried. So the people who were using the data, who were speaking to me, were saying, hey, whoa, what's going on? And then on a Friday evening, this email goes out from Rebecca Jones to the listserv. And as far as anyone on the listserv could tell, that was the person managing the dashboard and adding features and functionality and providing those updates. And she's saying she's been reassigned and to expect less transparency and accessibility in the data. And at that point, the email is out there in a listserv, and it's really, I mean, it's basically already public. It's only a matter of time before it's widely public. So between Friday and the end of the day Monday, having given the Department of Health, the Monday of time to get back to me, knowing now that, Rebecca Jones wouldn't have been able to answer her email. I emailed her as well, but, hearing nothing from the Department of Health by the end of the day, we decided to publish the story because we figured there's no way we're the only people who have seen this email. And by the time I wake up the next day, it's a national news story, and it's taken on a new dimension, which is that Rebecca's not just been reassigned, she's been fired, and she says that she was asked to manually alter data to drum up support for the reopening. So, and at this point, there's just a lot of unanswered questions. What data? What were the reopening metrics? Was it the dashboard data or some other data? And by the end of the week and sort of midweek, following week, the story has now become like very political, and some of these questions do start to be addressed, but ultimately the core issue, that transparency, accessibility issue about the data, that I think starts to really be addressed in the weeks that follow and the reporting that follows. And, I have to really say a lot of that reporting was done by the newspapers across the state. So, it wasn't just me. Far and away, it wasn't just me. So the reopening metrics that the state was ostensibly going by were supposedly adapted from the CDC's health metrics. And that sort of following that guidance seems to have gone out the window. You could see these metrics on one tab of the dashboard, but as the Miami Herald reported in mid-June, the reopening went ahead despite those trend lines on those metrics pointing in the wrong directions. I will say I was actually working on this, but got beaten to the punch by the Herald. So, hats off to them. Didn't help that I was being furloughed every few weeks, as was anyone working at most newspapers. We were hit by furloughs in April, May, and June, which I think for any reporter any newsroom was really adding to the stress and the challenge of reporting, because you'd be working on a project and then couldn't touch it for a week. But that's just sort of larger context. The Sun Sentinel further reported that the state's positivity rate was also calculated differently from how the World Health Organization and Johns Hopkins University and more or less anybody else was calculating it. Now, was that wrong? There might be an honest debate there, but it's certainly the way the state was calculating that number was spitting out a consistently lower number. So, one might ask, was this intentional? And then we found out, again, via reporting by the Sun Sentinel after the election, that there was, a gag order put on local DOH offices in the run-up to November, and deaths were reported with a lag, seemingly aimed at lowering the death count over the summer. And all throughout, getting answers from the Department of Health at the state and county level has been a challenge. Plenty of records requests have been rerouted indefinitely, never answered, or generated invoices in the thousands or tens of thousands of dollars, such as those requesting especially email correspondence of specific staff at DOH on specific days. I don't think this is a unique issue to me. I think any reporter in the state can tell you that transparency is an issue. And, all the while we continue to see instances of, misdirection, spin, at least misrepresentation of data. Most recently, it was a blip on the news, I think last week, the governor was talking about Florida's infection rates among school children and comparing it to other states, except for that the Florida number didn't include kids over the age of 14 and the other states did. So it was not a reasonable comparison to make. So, thinking about the title of this program, if there's a shot of truth in all of this, is that, yes, transparency is still an issue, but it, mostly manifests in these mundane and specific ways. And it's just a constant push from reporters across the state to get answers, pretty basic questions sometimes. So I think that sort of covers in broad strokes, I think the kind of larger context. That's sort of what I wanted to do, was talk about the reporting that has been done, because it's a lot. It needs to be recapped. So thank you. That's finito.
Thank you, Alessandro. Again, a round of applause. Again, I'm telling you, folks, if we were at a live event right now, you'd all be getting a standing ovation. Journalists, whether they are from Florida today or from any other newspaper in our state or around our nation, have been working hard to reveal the truth about this. And the truth, or lies, means life and death. It is undisputable that having our leaders lie to us is leading to the deaths of people all across our nation and around the world. If you're living in Brazil, if you're, I don't even need to go there because I suspect our next speaker is going to go there. But I wanted to thank Alessandro, because the job of a journalist is always been tough, but it's getting tougher every day. And I know that we have had politicians attacking the media and journalists as the enemy of the people, and nothing could be farther from the truth. The truth is, good journalism saves lives. Good journalism makes us smarter. Good journalism strengthens our democracy. So I'll tell you what, if you're not a subscriber to a newspaper and you're watching this, I ask you, please, before the day is done, pick one or more and at least get a digital subscription. Getting the paper delivered, reading what's happening, supporting newspapers is so important. Alessandro, you're raising your hand.
Shameless plug. I think we're doing a digital subscription. It's like $1 for the first 3 months. So shameless plug. If you go to the site, it'll be like a pop-up, I'm sure.
That is a bargain. That is a genuine bargain, and it supports. We could talk about this tonight all night, but it really, really is an important topic. So thank you again, Alessandro. And one thing I would like to remind our audience, and that is that we will be taking questions from the audience. And I mentioned it earlier, but we've got quite a few folks that have signed on since I first mentioned it. Those of you that are joining us via Zoom, in the bottom of your screen, there should be a little button for reactions, or to be able to raise your hand. And the ability to raise your hand basically gives us a heads up that you would like to ask a question. We'll be asking questions after our third speaker. In the meantime, we're asking all of you to sit tight, be patient. We've got you muted, but we're going to open up the floor after our third speaker is complete, and we'll be getting your input. We're actually going to encourage our panel to discuss the situation among themselves. Those of you that are on Facebook Live, you can send in a written question if you would. We'll bring those up to our panel. And I'd also like to remind everybody that, if you're getting a chance to kind of look around who our participants are, this is a chance for all of us as a community to know who's involved, who's interested, who we can reach out to. I'm hoping that our speakers will be open enough to take questions, or to hopefully, some way that we can establish interaction between our audience and our speakers in the long term. So thanks again. Our next speaker, a doctor, a scientist, a researcher, virologist, a good friend of the Space Coast Progressive Alliance, Dr. Dina Grayson, somebody who I consider to be a hero. I really think that she has opened a lot of people's eyes to how to behave during this pandemic, what the truth and what the falsehoods are associated with SARS-CoV-2. This is the real deal. This is not the flu. And Dr. Grayson, I'm going to ask you, if you would please, tell us your story. Tell us your perspective on what's going on in Florida, but also nationwide. You are really tuned in to what's going on in Washington and around our country. Ma'am, you have the floor. Please tell us your story.
Well, Phil, Raid, Bonnie, and everyone, thank you so much for having me back. And gosh, it's been almost 14 months, I think, since I last was able to see folks. It's been a long slog, everyone. And I'm physically sending you love and look forward to when we can get together safely again. And that will happen sooner than later, thankfully. So, I think the common thread here, and we've heard it from the other speakers here today, Rebecca, Alessandro, is the Republican assault on truth, on facts. Okay, this is the common theme that's happened here. And when you're in the midst of a deadly global pandemic, the assault on facts, whether that be the media reporting the truth, whether that be Dr. Fauci speaking the truth about science, whether it be me, others that have spoken up about the truth, Rebecca speaking up about the truth and having her home raided, all of these things, we're seeing this common theme. And the bottom line is that, as stressful as that might be for the individual person, the biggest cost and permanent cost are the over 500,000 Americans who are dead, our loved ones who are buried and gone, and we can't get them back. And many, 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 many of those lives could have and should have been saved, period. That, once we knew what was happening with this virus, if we can debate policy, I'm cool in the gang with that, okay? But we can't debate truth and facts. You can't, because if you do, you end up in a situation which is where we're at. So my story is our story. I don't have a specific story for myself personally, right? This is something that I've been studying these pandemic viruses as one does when you're a nerd like me and a physician and a scientist, and been developing what are called medical countermeasures for over a decade. These are medicines or treatments or vaccines or things that can help us fight off of these deadly, deadly bugs, specifically viruses, and have worked extensively with the Department of Defense as well as with the National Institutes of Health, including Dr. Fauci's group at the National Institutes for Allergy and Infectious Diseases. So I'm very familiar with the folks and the scientists because I've been working with them for many, many years. And moreover, I'm familiar with these nasty viruses. So when I started hearing reports from China, from physicians, I got very, very, very alarmed. And it was obvious to me very early on in late December that the situation had spiraled out of control in Wuhan. And again, what happened in Wuhan is a microcosm for what happened here. The truth was not shared. The doctor who was the whistleblower, who warned his friends, look, on a private chat group on Facebook, hey, there's a virus spreading here. It's like SARS. Be careful. That's it. Just warning them so they could protect themselves, because if our doctors and nurses get sick and die, then we all die, right? I mean, not all of us die, but the sick people die. So this is where we were at. And I started seeing this. And so I said to my husband over the Christmas holidays, and we do discuss pandemic threats as one does in the Grayson household. My husband, many of you know, a friend of the group as well, Congressman Alan Grayson. So I said, look, hon, I'm really, really, really worried. And I described what was going on. And I said, look, I think that China is lying. I think they're lying to their own people. I think, they're lying to perhaps their own leaders. Who knows what's going on there? But this is much worse than what they're saying. And then, of course, in sort of mid-January, suddenly, wait a minute, they're building a 1,000-bed emergency hospital, field hospital. That's when I raised the alarm. I have a large social media account, as I think folks know, and I raised the alarm. And I said, this is just the beginning. And I described, hey, here's my history working on these, and this is why this is so worrisome, because this thing was very clear. Not only could it spread person to person through the air, which is one of the big I've worked with the 3-letter agencies on what are we scared about with respect to these viral pandemic threats. So spreading through the air, that's super easy to spread. So everyone gets freaked out about Ebola, which is bad, but it's hard to catch Ebola. Like, you actually have to touch somebody who has Ebola or touch their bodily fluids. Okay, and that's not easy to catch. Obviously, we know that COVID, very different scenario, much easier to catch, easier than even we thought. I think, even than Dr. Fauci thought initially, to be quite frank. This thing spread much easier than really my worst nightmares in many ways. And we knew it was deadly in otherwise healthy people. And especially when you're in a situation like Wuhan, like New York City, like LA recently, where you start to have to ration healthcare, that means people that don't get rationed that healthcare, It's these Republican death panels that they fear. People die. This is what really, really happened. So that, when I started raising the alarm, because we were in a situation, and I got to tell you, this is where, thankfully, I had that experience, of being able to go on television and talk to reporters and feeling comfortable, because there were very few scientists and experts that had a platform and could speak out. And we had the government leaders lying to the American people, lying. Right? Everything's going to go away like Easter, like magic, like a miracle. I mean, this is not Harry Potter, right? You don't wave the wand and it goes away. And we had it all the way to the top, right? All the way to the White House, lying to us, and getting rid of the leaders, not allowing them to speak to the media, and lying repeatedly. And so I felt this obligation. We have to speak out. We have to speak truth. People need to know what's happening. And I have so many people that tell me still to this day, look, Dr. Dina, thank you so much, because of you back in January, I bought masks. I stayed home. My parents are alive, thankfully. But that shouldn't have been on me and Rebecca and Alessandro. I mean, thank God we have, again, a free press, but this assault on truth that Alessandro's had to deal with, that Rebecca's had to deal with, that I've had to deal with, that Dr. Fauci, poor man, the guy works 16-hour days and he's dealing with death threats. He can't go jogging anymore because people want to kill him for telling the truth. I mean, this is where we're at. This is the Republican Party. It's Trump's Republican Party. And look, there are Republicans, elected leaders that are, finally are starting to say, okay, enough is enough, but barely. I mean, this is the sad state we're in, where let's embrace fiction. Let's embrace sedition. Let's embrace factless, baseless claims about a deadly virus that has cost lives, even cost Republican infection rate, by the way, of elected leaders is like way, way, way higher than Democrats. And the Democrats are getting infected are typically like, well, we were locked up because the Republicans try to overthrow the government and they wouldn't wear a mask when we're locked up in the same room. So now we got COVID from these idiot Republicans. I mean, this is where we're at. It's mind-boggling to me, and frightening in many ways, because it's not just them, it's tens of millions of Americans who've been brainwashed. They've been brainwashed into this cute idiot stuff. They believe it. I read it on Facebook. People arguing with me because they read it somewhere. And I'm like begging with them, and you have these conversations with people and they're in fantasy land. And this is the frightening thing where we're at. This assault on truth. My worry is not just, we are going to get through COVID, I hope. And I think what's going to happen is those that choose not to get vaccinated, they're going to get sick. We're already seeing that. We're seeing people get sick. Look at the infection rates, of people that are doing, it's like North Dakota had no reason to have a huge outbreak, except that they have a COVIDiot governor, and who cares more about, I guess, being on the national stage and being, on the Trump stage than protecting the people that she's elected to serve. So this is the reality of where we're at. I think the very good news is, thank God we won the election. Thank God. And I hope people are home cheering, because I know that everyone here I would say in this room, this virtual room, you guys worked your butts off to make that happen. And it matters. It matters. Leadership matters. Was President Biden all of our first choice? Maybe not. But I'll tell you what, he's a hell of a lot better than a lying, seditious scumbag like Trump, who was in the White House, who cost lives. That literally cost lives. When he was telling people to inject themselves and ingest bleach and disinfectants and advising that, people died because of that. And you got, Deborah Birx, where I guess drunk with power, I don't know, but she looked like a hostage video. I'm going, speak up, please speak up. No, don't do this. I mean, that's where we were at. And now we have briefings by the experts. It's such a relief. I don't have to do that job anymore. I'm so relieved, because now we have Dr. Fauci, and the White House COVID team is fantastic. And they have a plan. The Trump administration had no idea how many vaccines were being made, where they were. They just said, ship them out. You in the States, you deal with it. And of course, the public health departments, because, they're super well funded, not, they're overwhelmed trying to do testing. Now, all of a sudden, they're supposed to do vaccinations. And, the Republicans, of course, want to take money away from public health, not give public health the support and financial support specifically that it needs to actually serve us, the people. So this is the craziness we were dealing with, but the great news is we do have great leadership. The vaccines are rolling out. People are getting vaccinated. That's the really cool thing. The bottleneck is not finding people who want to get vaccinated. The bottleneck is getting those jabs into arms. And that is ramping up, and it's going to start really ramping up over the next 3 months. So that is the fantastic news, that we have 3 great vaccines, Moderna, Pfizer, and this Johnson & Johnson one. Do not poo-poo, do not. That Johnson & Johnson vaccine is one shot, and it protects against the new variants, 0 hospitalizations, 0 deaths, one shot. Now, I will bet you a pretty penny that if Moderna and Pfizer had one-shot data, they would not fare any better than J&J shot. And they're testing 2 shots right now. They just want to get it out there. And so it is at least as good as the others. Take it. The key thing is we don't want people getting in the hospital. We don't want people dying, right? That's what vaccines are supposed to do. And it protects against the variant. And we're going to have new flavors of these vaccines coming out sooner than you can imagine, where they're going to protect against the new variants. This is going to be like influenza. We are going to have vaccines and updates, probably not as frequently as influenza. I don't think it's not going to be every year, but that's the great news. And right now, thank God, we have leadership that embraces facts, embraces science, lets the scientists speak facts, lets the reporters in the room to ask the questions of the scientists directly, so that reporters like Alessandro can report the truth. Because we Americans deserve that. We have to, people are intelligent. They want to make decisions that's best for themselves. If people want to wear a mask and go on a plane, take that risk, that's their choice, but they need to be armed with facts and truth, not lies and fiction, right? I mean, I've just never seen a virus that just doesn't exist. There's no such thing. It's a fake news. So 500,000 plus dead Americans is fake news. I mean, this is really getting into that, you're talking about despotic regimes like, I don't want to compare it to make that the comparison that everyone's thinking, but you're in despotic regimes where there's, the dead bodies everywhere and they're just denying it. No, we're not that stupid. So I do think, and I said back in January, people asked me, how long is this going to be? And I said 18 months to folks. And I knew that there would be that horrible, what I called the second wave. It turned out to actually be the third wave. We had a second wave in the summer because of places like Florida in the Sun Belt, where we're indoors with air conditioning. So seasonality reversed. So our winters are really not maybe flu season, or at least the coronavirus season. It's summer when we're shut up inside indoors with all the windows shut and the AC blazing. So I saw that third wave coming, but I thought maybe possibly if a miracle happens, the fastest we could get vaccines. I did not think vaccines would come this quickly. I got to tell you guys, I really thought it would take a few months longer. And that was like if everything went right. These are modern day medical miracles. I'm so proud of my other nerdball science, like science wins, yay. Because, people are going to win Nobel Prizes for this and they deserve it. I mean, this is saving humanity, and great vaccine platforms that we can make new flavors of these vaccine platforms easier than flu shots. So we have so many good things coming, folks. But I tell you what, we did not need to pay this price. We did not need to pay this price of 500,000 lives. Nowhere close to that. We can look around the world and see how bad it was in other countries, but then they got their crap together and decided, you know what? Shutting down the economy to save lives is worth it. And Republicans chose death panels. And I will never, ever, ever forgive Ron DeSantis, ever, ever, ever. Donald Trump and his cronies, that all he cared about was winning an election. Well, he almost died from the virus himself. He got very, very ill. And he is the only, I'm not going to say the only reason he was alive, but he was very, very ill. And I said this at the time publicly as it was going on, because I knew they were lying, not only about the virus, but about, forget who he is, but the position when the president of the United States is deathly ill. The American people deserve the truth. We didn't even get the truth about that. So thankfully that's behind us. I want to, my action item for everyone here today is, first of all, thank you for all the great action that you already do in your advocacy for progressive ideas, for progressive elected leaders. You guys are awesome because you put your thoughts into action. And that's, this is democracy. What we saw in November was democracy, right? And we got to fight like hell in every election like that because we can and will win. We know that. So that's part of my action. And then the other one is, look, do not let your guard down. We are very close. We have these COVIDiot Republican leaders who are dropping early, right? We're still in flu season for another few weeks till the end of March. And we have these new variants circulating and spring breaks coming up. So I am worried. So be vigilant. The good news is if you are vigilant for yourself with wearing a mask, washing your hands, keeping socially distant, all that stuff that we've been talking about and everyone knows, and shut up, Dr. Dino, we know this. Okay. But if you guys do that, if we all do that, then we are reducing risks for ourselves and our loved ones. So if we keep doing that, the COVIDiot's got a COVIDiot. That's just, unfortunately, keep fighting for getting us elected leaders that will embrace science, will embrace facts, will embrace the reporting of the truth by a fair and balanced press. Let's do that. And our country and our world will be even better. So thanks again, guys. Happy to stay for a few questions. And I love all of you. I can't wait to see you in person. Thanks.
Dr. Grayson, again, as I've said before, this would be a room full of people standing up, giving you a round of applause and certainly some hugs if we could. And when we can, we will. Again, I want to thank all of our speakers. Holy cow. What a wonderful group of people we have here tonight with us. And we have a terrific audience too. Honestly, I was looking through, Hugh's here, we've got a lot of friends. We have a few guests who are new to the group, and I want to welcome all of you. It's exciting to see all of you. And now this is when we turn the meeting over to you, the audience. I saw that we had a hand go up early in the game, and Claudia, if you are available and you can unmute yourself. Claudia, you have the first question.
Thank you very much, and thank you to the three speakers who are more impressive than I can even say. Two questions, one for Rebecca and one for Alessandro. Rebecca, every time I hear you speak, I realize you're more brilliant than I even thought, and I wish everybody could hear you speak. So keep talking. My question to you is, I think you still have one GoFundMe site that is live, Help Florida Scientists, correct? And if so, I'm going to go there unless you can tell me a better way for me to help you, not only your data work, but you as yourself and your family.
Yeah, I guess it's still open, but I'm not like trying to fundraise. I would actually prefer that if you could, you donate that to help somebody in your community. Because there's a lot of people struggling right now. And I think
already doing that, will do.
I at least hope that this will not last for like a decade and I'll be okay. So for now, I'm okay.
Okay, thank you so much. And just keep preaching, we'll preach for you. Alessandro, as a supporter of you for quite some time and somebody who deals with my 4 houses away neighbor, Sheriff Wayne Poison Ivy, I can tell you that I understand about transparency or lack thereof. And I'm now dealing with, as a new member of the very new Community Advisory Board for the Titusville City. I've already had a meeting with Chief Lau, who is already dissing the Florida Today and saying he doesn't trust it. So just know that I will be disputing that at every meeting. And if I just wanted to make sure I'm sure you're already aware of it. If there's anything that you can share with me as ammo, pun intended, not the next time I have a meeting, so that I can say, no, he's not falsely accused or spreading lies about you, Chief Lau. Florida Today is trustworthy and I will always support them. So if you, maybe you could give information to Phil to give to me or send me a link somewhere. So
just say, read the paper. I've never had the pleasure of meeting Chief Lau, but if he thinks that of me, I'm sorry to Chief Lau. I'd love to have a coffee.
Okay. Maybe we'll invite you to a future meeting and watch him not show up. Okay, thank you.
No comment.
Okay, our next question. Let's see. I see that our president has his hand up, so I'll tell you what, let's hand it right over to Riot. You have a question.
Right.
Thank you, Phil. And this was really great presentation by all three. And just one before I start, thank you again. And hopefully, I know Dr. Grayson gave us a prediction a while ago. So I'm trying to see if she can give us another prediction now. I'm tired of staying locked up. The world is tired of this. Businesses really been affected. Internationally, I call different countries and they're devastated by this. Prediction in general, how do you predict this is going to end? When can we get together? When can we open up in a safe way? That's the first question. And second question is to Rebecca. And I know there's a balance between, I manage, I'm in management and I tell, my employees, sometimes rules are made to be broken. And to do things, it's got to be the ethical, it's got to be legal, and it's got to be within budget, as we say in business. So from your perspective, I know there's some legality issue. If some people say that legally, can you do what you did? But ethically, I would do what you did, of course. How can you balance between ethical and legal? And how can you can you elaborate on that when you made that decision?
Sure. So I can take the first question, and it's the question that I think that everyone wants to know. So the great news is that the Biden administration has accelerated the availability of enough vaccine doses for every American by May. So they're going to beat the timeline by 2 months, which is phenomenal. A big part of that is J&J's vaccine getting emergency use authorization from FDA, which is fantastic news, as I said. So but that doesn't mean we have the availability of vaccines, but we know that those needles don't just hop into arms. It takes time. So I think that from a big picture, United States only, let's focus on that, because the rest of the world is more complicated. Every country is different on availability of vaccines. So here, I think late summer, we're really looking at likely getting closer to normal. Holidays, I think, with your loved ones, I think what we're looking at is slowly increasing the size of your bubble, if you will, as your our more vulnerable folks, our older folks, people higher risks are getting vaccinated. That's wonderful. But then obviously the next wave is going to be adults that are really not high risk. Once we get a lot of folks like that vaccinated, then it's so much safer, right? Because the virus can't really spread very rapidly. This is making assumptions that we aren't going to have a new variant that will totally evade the vaccine. I think that's a fair assumption. I think that we're in a race. We've got to vaccinate faster. Reopening more quickly increases the risk for new variants, which is not good. But I think that's really where we're heading. So it's more of a gradient. It's not like all of a sudden we just flipped a switch, right? It's more of a gradient of by community. We're lucky here in Brevard. We're not urban. I think that we've been relatively luckier compared to obviously other parts of the country like the Los Angeles area. And we're more humid. We have breeze all the time. All these things help, to decrease the spread. So I think that's the answer here. With respect to the rest of the world, it really depends on the country. And one of the things, it's no surprise, the Trump administration, of course, we're pulling out of the WHO, the World Health Organization, as well as these global vaccine initiatives. Essentially, the goal here is that wealthy nations like ours, the wealthiest on earth, and let's face it, we're the most biomedical rich nation on earth as well, but nations collaborate to donate vaccines so that the rest of the world can get vaccinated. Because what we know is this virus does not care about country borders. It does not care. It crosses them, and we know it spreads like wildfire and infects you. It can kill you. So the key is not just a national strategy, but really a global strategy, because the longer that we allow this to fester worldwide in places like Brazil, where it has a total COVID leader, Bolsonaro, of course, the longer we allow that, the more shots on goal we get, the more likely we have mutations, and then that virus evades the vaccine and comes and we're in another challenging situation. I do not think that we are looking at another pandemic nightmare situation like we've been facing. I do think we are getting over the hump. Okay, I really do, and the vaccines will help prevent that. I think worst case we're looking at like the influenza type of situation where we can have these pandemics, unfortunately, but we're generally better at handling those when we have non-COVIDiate leaders. So I hope that answers your question, right? I wish I could say May, but late summer into the fall.
And it's true that elections have consequences. And unfortunately, in this case, the consequence for choosing the wrong leader for many of our friends and family members has been death. It's almost breathtaking to watch how choices were made, both at the national and state level and around our country, where there have been people who have just intentionally made the wrong choice over and over and over again. And you would think at some point they'll learn. Anyway, we had another question from Raed for Rebecca. Rebecca, are you ready to take Raed's question? You remember it?
Yeah. So I'm definitely a person who grew up having the attitude that the rules are meant to be broken. But I think my position here was actually trying to stay with the rules, not break them. Because what I was asked to do to falsify health records and mislead the public is illegal. And I said no. And so I wasn't trying to break the rules, they were. Now I think of like Reality Winner, who broke the rule to, leak the documents that she did about Russia and election and everything. That's breaking the rules when it needs to be. But I was actually, for once in my life, trying to follow them. And ironically, it got me rated. So, but yeah, it depends on the circumstance. I think if I had been put in a situation that would have had the same result, but I would have had to break rules to make people aware of it, I probably would have done it.
Thank you so much, Rebecca. Our next question is from our Vice President, Karen Houston. Karen, you have to unmute yourself if you can. Karen, you have the floor.
Okay, so this is for Dr. Grayson. I have a question. I don't know how often you heard this one, but I'm a little apprehensive about the vaccine simply because I have respiratory problems. I have asthma. I actually had a bad reaction from a flu shot one time. It left me in the hospital for a week. So could you address that part of it for people who have respiratory problems already?
Sure. So hi, great to see you. And thanks again for your great service to the community. So that's, first of all, just having respiratory issues, you really want to get the vaccine because we know that this is a respiratory virus. It's also a weird virus. It's a cardiovascular virus. So if you have cardiovascular risk factors as well, those are really even greater risk factors, unusually, with this virus. Actually, male gender is more of a risk factor for reasons that aren't quite clear. Perhaps some differences in immunity between different genders. So with respect to having had a bad reaction, my advice to you, and again, definitely discuss this with your doc or other healthcare provider, would be probably try not to get the Pfizer vaccine. There are very, very, very rare allergic reactions. So people that have like bee sting allergies, peanut allergies, they've had an allergic reaction to the vaccine. And that's happened in a handful of people out of many, many, many millions of people who've been vaccinated worldwide. So the risk is really, really tiny. So if you've had, I don't know what kind of reaction you had as well, but just, discuss with your doc, maybe that's not the one. Get the Moderna, get the J&J. Luckily, we have 3 different flavors. There have not been allergic reactions associated with the other vaccines. These vaccines have been tested now in tens of thousands of people. They've been very safe and well tolerated. The worst, we've seen these rare reactions. The most common things are just some mild flu-like symptoms for a day. Some people have gotten some pretty high fevers for a day. I'll take that over COVID. Thank you very much. So when you think about benefit risk with anything, you always want to think about, we know that there's a known risk of this nasty virus circulating. We know that the vaccines are highly, highly effective. All 3 of them, highly effective at preventing hospitalization and death, which is great news. So from a benefit risk perspective, and we know these vaccines are safe and well tolerated and have been really tested and widely. And the nice thing is now we're at the point where we're almost up to 1 year since the first people got dosed with the vaccines, because it started last June. And we're still seeing safe, well tolerated, safe, well tolerated, safe, well tolerated. So, many, many, many millions of people have received it. I think that you should have a lot of faith and confidence in the vaccine. So I would urge you, your family, if and when you have the opportunity to get vaccinated, folks, whichever one you get, take it, take it, take it. And in your case, Karen, I mean, just maybe think, maybe not the Pfizer one with your history. And luckily, there's 2 other really great flavors out there. So maybe not, you don't want raspberry swirl, you want a different flavor. So go with the other flavors.
Thank you so much, Dina. We've gotten a question via our chat room, and it is for Rebecca. And it says, are you able to find employment? If not, are you looking to an unlawful termination suit? Are you attempting to, it says you were attempting to give the public the truth, so you would be a significant person in the state of Florida, if not a hero. And there is no shame for being called a hero. Ma'am, you and your family, your husband, your children have been through so much that you did not deserve. And I know that you had to literally flee the state in fear. It's a horrible situation you've been in. What can you tell us about that, finding appropriate employment?
Well, I started actually immediately trying to look for jobs. After I got fired, I got at least, I think I counted at some point, 60 something people telling me, oh, they had a job. But because of how what I do is mischaracterized, a great number of those offers were jobs I don't do. They were like software developers and things like that. And as time went on, I decided that, I'm just going to let this cool off, do my own project. Because so many people supported me, I didn't need to find something immediately the way that I felt when I was first fired. And so I was privileged enough to do that and to be this role for Florida. But it's dawning on me that no one wants to hire a whistleblower. No state government wants to hire someone who they think will be more loyal to the public and public safety than their agenda. And even though I stomached a lot of stuff that I personally was uncomfortable with before I, said, no, I won't do this. And even though I did not go public myself, like on my own choice, that seems to be more of a gamble than many are willing to make. And so I don't know what my next steps are. Maybe I'll be more of an advocate, an advocacy role for science, communication and education. I don't know. My whole world in the last year has been thrown upside down. It's almost completely foreign to my life before this. So right now I'm just trying to, one day at a time, do as most good as I can and then see where it takes me.
Well, good things happen to good people, and ultimately you may hopefully find yourself in a better place.
I used to believe that. I used to believe that, there was karma, that there were consequences for people who did bad things and that good people would be rewarded for doing good things. But with the amount of unnecessary and preventable death this year of people who are good people and just got sick and died, I'm still trying to have faith. Honest to God, I'm still trying to have faith, but it's been really hard. It's been really hard.
It's an interesting question. Dr. Grayson, you are well connected in Washington, and you've seen an awful lot of good people who've stepped forward, who've been slapped down, frankly, people who've been whistleblowers who've stepped forward. We probably have a big list over the past 4 years of folks who've fought back. I can think of a few guys in uniform, the president's former lawyer, people who've tried to come forward and say, hey, by the way, here's some information, and they've been treated poorly. But do you have any thoughts, any guidance, any insight for Rebecca?
Well, gosh, I was thinking, Rebecca, you need to speak to my husband, Congressman Grayson. He's also a Harvard trained attorney and he won the first whistleblower lawsuit against an Iraqi war profiteer, Halliburton. And was on 60 Minutes for that. So he's a badass attorney and he's a true progressive warrior. So that's my dogs chiming in, by the way, in the background, if you can hear that. Dog fight. Anyway, sorry about that.
A dog fight.
I have
It's
to go
great.
break. Yeah, who knows? Old boy dogs. They're twins. They're having a row, probably over something. One of my kids probably playing with them. Sorry about that. So, I think one of the things Rebecca said though is spot on. Whistleblowers. It's like this weird backward stigma. Folks like us cheer whistleblowers, but then, look at Colonel Vindeman, right? He's not, he's out of the military. He's, where's he going to get a job? He's not going to get a job at any sort of, national security council like he was before. What is he going to be doing with his life? I mean, and great patriotic American who stood up and did the right thing. Or, Trump was trying to sell our country out to Ukraine. Whatever it takes, he'll do whatever it takes, right, to win. So, on that one, I think that this is something we as a society, I mean, Rebecca, I would urge you to think broadly. Like you said, I think it's good you're taking time for yourself. And I've done Control Alt Delete in my career multiple times. It's somewhat freeing. And there's, sometimes doors close, but other really interesting doors open. It takes you a little time to sort that out. And that's something I would urge you to do, because I think there's clearly a lot of need for someone with your talents and your moral compass out there. So, there might be some things you didn't consider before. Maybe think more broadly is what would be my advice. The government, you're right, especially Republican government folks. I mean, whistleblower. Yeah, that's great. You did that. Great. But, which is a very bizarre mindset to have. My husband does not have that point of view. So anyway, thank you again for what you did.
Excellent advice. And I'll tell you what, I should also ask Alessandro. Journalists are often put in the line of work, are killed, are put in horrible positions, sometimes not given the credit that they deserve. They do a lot of sometimes work behind the scenes that never is recognized. You even talked about it yourself in the course of the past year, having been put on furlough periodically. It's a horrible position to be in. When you look around in the world of journalism, and you've got to be thinking about, hey, what about my job? What if they boot me out of here? I know that folks are leaving Florida today to go to places like, let's say, the Miami Herald, or whatever. Do you feel comfortable? Do you feel stable? Do you feel supported at Florida today?
Oh, absolutely. And to be clear, I mean, you're talking about Isadora Rangel. I mean, she was our opinions editor, and she was offered a job at the editorial board of Miami Herald. That's obviously a step up for her career wise. So, that move, I think, was, I mean, I don't know, you have to ask Isadora why she left, but I don't think it had anything to do with people not being supported at Florida Today. It's a great place to work, and I love my editors and my colleagues. It's true that the news industry as a whole is very precarious, which is why I shamelessly tell people to subscribe to the newspaper all the time. In terms of threats, like obviously, the furloughs were across the whole company. It wasn't like specifically me. It was everyone was affected. So, we were all sharing in that issue, but, and that lasted 3 months and then it ended. Look, like, I think it's increasingly difficult for journalists to report the news in a way that people think about the news being reported. And what do I mean by that? Like, just the number of reporters working in the United States has dropped precipitously. So there's less of us trying to do more. And the way people conceptualize the news, I think, has also changed a lot. People have expectations and ideas of what a reporter's role is that I don't think really comport with reality. And I think part of that issue is I think reporters need to do a better job communicating how the sausage is made to some extent. But I feel like I'm drifting from the original question, which is, do I feel stable? Yeah, I feel stable, but not any more stable than anyone in the industry, which is, it's an unstable industry because the business model needs to be resolved. I mean, these are structural issues that existed before, I was in college even. So, it's there's a lot that needs to be addressed. What does the future of journalism look like? I don't know, but, I think there's always going to be a role because, if we want to believe that there is a demand for reporting, then, I think ultimately there will be a way of doing it. I think the most important part is that as politics have become more polarized, there's this idea of reporters, kind of like existing in this weird middle space, which is increasingly non-existent. Look, I mean, I think the main point is, as people tribalize, just like it's important we keep seeing each other as human beings. Like I speak to people across the political spectrum, and so, the only way I do that is because I meet people on what their terms are. I mean, everyone has a certain level of dignity and decency and able to recognize the humanity in each other. And then when you pick up the phone and you call someone who you think might be, hostile or friendly, doesn't really matter. When you're talking to another person and you communicate to them that you're a person, it gets by. Like certainly, we're not at the point in this country that I think reporters are suffering in other countries. When I was in Cambodia, there were real physical threats that existed for reporters that, we might be seeing a little bit of that here and there in this country, but not to the same scale as in other countries. We're not there yet. And I don't believe or want to hope that we're heading there, because those are very difficult conditions to be a reporter in.
We certainly want to thank you for being here. To tell you what, we've had former editor Bob Gabordi, Mara Bellaby, our current executive editor at Florida Today. And if Mara, if you're on and watching us, Alessandra's doing a great job. So for what it's worth. Anyway, we do have a question in the chat room from Sally, and it is directed to Dr. Grayson. And it says from Sally, she says, my friend has Lyme disease and she got COVID in the fall and she is still sick with COVID. She's considered a long hauler. She said that her doctor said that the vaccine will not help her due to her Lyme disease. Is that true? What diseases are contraindicated for the vaccines?
Yeah, this situation sounds a little muddy. That doesn't make a lot of sense to me. I think that there's not really data on whether or not the vaccine will help if you have long COVID. First of all, Sally, I'm really sorry for your friend. I mean, long COVID is horrible. There have been many young people that have been struck by this. It's very frustrating, and something that I wish I could say, here's the magic, secret magic wand that I can wave and it goes away, because that doesn't exist. So there's no evidence that the vaccine will help with the long COVID. So I think that's what's going on. As far as Lyme disease, I'm not aware of that being a contraindication for the vaccines, as far as I'm aware, at all. I think that if somebody is on anti-inflammatories, that's a different story. So again, that's something I don't give medical advice out over Zoom, and nor should you take some medical advice from me over Zoom. So, that would be your friend, Sally, would need to speak with their healthcare professional and probably bring someone with them, because this is a complicated situation. So maybe somebody else who can also help them ask the right questions and take some notes is always helpful for something like this. But I certainly would urge your friend to seek a second opinion if they're hearing they shouldn't get the vaccine. Again, there are some good reasons why you shouldn't. One of the reasons why we want herd immunity is to protect those who cannot get the vaccine, not because they're COVID-idiots and they read something from Uncle Earl on Facebook, but because they truly can't get the vaccine because they truly have a contraindication, like an egg allergy for those with the flu shot or something like that. I mean, we have people that just can't get vaccinated, or their immune systems are run down and they can't get immunity. So those are the folks that we want to make sure that we protect. So having said that, I really wish your friend the best, and for all the folks out there that are suffering from long COVID, it's my heart's with you and your families and your loved ones.
Thank you very much, Doc. There's been a lot of discussion here on our chat room. We've got people that are offering you, Rebecca, they're offering you sanctuary up in Seattle, which is kind of neat. And let's see, we've got somebody with a quick written question, and I can see that Daniel DP has had his hand up. Would you like to ask your question, Daniel DP?
Yeah, so first off, I want to start my questions for Rebecca, but I want to agree with everybody here. You may not think so, but we all consider you a hero, and at the very least, a role model. You did the right thing, and you're inspiring other people to follow in your footsteps and do the right thing. I also want to agree with Dr. Grayson. When you start speaking, it's obvious that you're brilliant, and that leads into my question. Of all the work that you did on the dashboard, I'm curious, because I'm a nerd here too. I'm curious, how many lines of programming code approximately, and how many languages did you have to use to put that all together? From the front end that everybody sees to the back end, where you may have gotten scripts that are pulling from one data set with line item data and crunching it down to make all these other data sets. Exactly how complicated, how much work did you put into that? Because I'm very curious.
So SQL was used to query the Merlin database, which has all of our case data in it. To prep everything and cross-validate with the DOH PDF reports, I used R. I was educated in R as a climate person in college. It's open source software, it's the best. But it's not so friendly. I mean, there is an R ArcGIS bridge, but I never got around to doing it. So after I was done, you SQL to query and then R to do all the actual like building those data sets, I had to move to Python because Python communicates with ArcGIS software. And that would be what pushes all of the products basically and data from, development to production. And then the actual website itself was HTML. So I know it's a lot. The R code, I think it was almost 1,000 lines for the R code. I mean, we had gone through and, cleaned some things up and trying to condense things. I learned new tricks along the way that I had never had to deal with a database this size. I mean, hundreds of thousands of records. So I had to learn some new things, but I used SQL to kind of clean up how it was exported. So single record files, and then R to do it, and then Python to push it out, and then HTML to make edits to the website.
So you are basically a software developer. I love it. Thank you.
No, I don't feel comfortable because I knew enough of Python and SQL to be able to do those things, but I would not call myself an expert in either one. R, I'm obviously more familiar with, and HTML from back in my graphic design classes in college. But if you ask me to build like an application for any complex thing, I don't know if I'd be able to do it beyond, R programming and Shiny and things like that. But yeah, it was a lot. And that's why it took 6 people to run it after I left, because they didn't have any other one person who had acquired a lot of those skills during that process to do it. I mean, I was the GIS manager for the entire Department of Health. So it was a given that I would know more about it than anybody else that we had, but I was the only GIS certified professional other than one other person who actually destroyed the dashboard when he took it over. So, it was a lot. It took a lot, and it took, between 12 and 16-hour days to get everything done every single day, especially when we were doing updates twice a day. And I was kind of relieved when we switched to once. But to be honest, I know a lot of people were like, well, why? And I was like, you have no idea what goes into doing these updates, do you? Because trust me, once is better. Once will keep your data person happy. But yeah, so it was a lot. It really was a lot. I still have all the code. So
See, that's
Not
what
that
I
we can
thought.
use it.
Thank you. Thank you so much. That's exactly what I thought. And months ago, when I heard everybody saying, she didn't do anything, she just put blocks together. I knew that. I knew exactly what you did, and I wanted to give you the opportunity to say, how much work you actually put into that. So thank you.
I think it's wonderful that we actually can talk about that in an open setting here, because for a lot of people, those of us that consume data, that you read the newspaper, you go to the Johns Hopkins database and you take a quick look to see what's going on. To understand how incredibly fortunate we have been here in the state of Florida to have Rebecca to do this work. For much of this pandemic, I personally, and I suspect a lot of you folks have too, at the end of the day, I sit down and take a quick look through the various databases. I look at what the New York Times has out. I look at what Johns Hopkins has got up. I go to the Florida Action site. I take a kind of look around and kind of mentally compare them with the actual data, the Department of Health. It's not like I'm writing this down or writing a report, but you kind of like to know. And I guess one of the things that I'd like to ask all three of our panelists is, when you want to know what's going on in your neighborhood or around the country, where do you go? For each of you, please, in turn, where do you go to get the latest data, the latest facts? If you want to get a quick update on what's the trend line, where do you go? Who do you like? I don't know who would like to start first.
I'll go. I used to go to the COVID tracking project, but this is actually the last week that they've done updates, unfortunately. But they have done a stellar job. And that's where I have always gone. If I wanted to get data, the best data that was out there, COVID tracking project would do it. Alexis and his team at the Atlantic did an amazing job.
Yep, that's exactly where I went. Initially, early on, I went to John Byrne Murdoch from the Financial Times. Actually, he's kind of a data graphics viz guy. He was actually one of the early people to really be tracking the pandemic worldwide, which was really helpful. And then we had the COVID tracking project, which has just done a phenomenal job. And now I will be looking for CDC. Now that the CDC is allowed to speak truth, the scientists have been unshackled, unchained, right? And the whipping, the daily beatings have stopped. That was a joke. But they have been, I did find, by the way, some great irony that we flipped Georgia and the CDC is headquartered in Hotlanta, Georgia. It was like, yes. And I have friends who are like, Dina, we did it. So at CDC. So that was really just great news. So, I think that the COVID tracking project has been fantastic, and we'll be looking for great resources from the Biden administration. I have every faith and confidence. For example, the CDC has a fantastic tracker page on vaccinations. That it's absolutely fabulous. It's updated at least daily. You can see even by different age groups and state by state how well vaccinations are going. I think that's a really wonderful resource as well. So, and I am confident that we have great facts coming from our government that will guide fact-based, science-based policies.
Hallelujah.
And sorry, we have a little bit of a cameo because I had to split up the, this is one of my 14-year-old twin dogs. So pardon me. Biden decided he wanted to say hello to everyone.
Excellent.
Sorry about that.
We love having extra guests. It's just fun. It's fantastic. Alessandro, do you have any favorite sites that you go to? Do you have any back channels through the media, LexisNexis or something else where you get a deeper dive into factual data, especially on this pandemic?
The media has no special channels. We use the same channels the public uses at the end of the day. It's nice that there's sites like the COVID tracking project, which do their visualizations a little differently. Ever since end of January, we've had the CDC website has had a whole lot more information all the way down to the county level. So, while for, our daily, every day the paper publishes the numbers for Brevard County, that comes from the PDF still from the DOH, because that's what we did from the get-go. So to keep it consistent, we kept on doing that. But then, like when I write maybe a trend piece or something, I'll take the DOH numbers and also look at how it compares to the CDC and the COVID tracking project and whatnot. So, the CDC especially has some nice analysis tools baked into it on their site, which have been fun to look at.
Good. And I'll tell you what, we've got, again, continued action on our chat room. Somebody, David, said filing a complaint, an employee or his or her representative can file a whistleblower complaint with OSHA via mail, fax, telephone, or in person online against an employer for unlawful retaliation. It is imperative for the complaint that his or her representative to provide OSHA with current contact information. That's just kind of a general background for anybody that's planning on being or finds themselves in that situation. I can tell you that in the airline industry where I spent 23 years, that they have a wonderful program for those of us that used to fly airplanes. And so it was run, it still is run today by NASA. And you could file what they call a NASA report. If something was up, if something was going wrong, if you saw somebody doing something wrong, you could send in a NASA report. And it's a really interesting program through the government to provide honesty, safety. I certainly wish that existed for all of our civil servants to use something like that. Hopefully, in the quest for good government, we may find this is a perfect opportunity, a wake-up call for all of us that maybe we need something like that for all of our civil servants. I'm looking for our next question. Let's see. Sally Brown is saying that, Rebecca, she hopes that you go on NPR and tell your story. And she had says thanks to Dr. Grayson, and she heard you on NPR. Dr. Grayson has done an awful lot of work at getting the word out for this, and she's been a wonderful resource for all of us. So we have all three of you, our speakers on our team, who have been helping the public, hopefully helping our community to make hopefully better decisions. Do we have any other questions here? Looking for any questions maybe coming in from Facebook Live. Have we had any of those?
No questions from Facebook Live. There's a lot of chatter in the on the live broadcast, but no specific questions.
And I see that Bonnie is waving her hand. Do you have a question? No, she doesn't. She may be pointing at...
Sally has a question. I see Sally raising her hand.
Okay, so Sally, would you like to talk directly, or do you want me to just read off of your chat?
No, it's a quick question. How accurate is the Worldometer? It's online, and that's what my husband always used for the statistics. And are those very accurate? And because they're for COVID cases all over the world. Is that very accurate? It's called the Worldometer. Is anyone familiar with it? Can you hear me?
Yes, we can hear you.
I'm not sure how it's run now, honestly. Yeah. I used to get people asking me why our numbers were always different than Worldometer. And my response was literally, I have no idea who runs that or where they're getting their data from, but it always seemed to be off, but maybe now it's right. But in general, I try to stay away from things like that. Unless it's like a specialized kind of focus on that, like Johns Hopkins, which now has an entire COVID-19 office, basically, of specialists tracking this data. I would be skeptical, but I also don't know if they've changed how they do things in the last 6 months.
Sally, I think you may be muted again.
Rebecca, how accurate are the numbers abroad, like international? I know you have no, control over that. What CDC or, because I'm curious what the numbers are abroad, how accurate they are.
I don't know. I really have no idea because it's so complicated. I mean, they've got to be pulling from somebody. And I would rather look at whoever they're pulling from and just, go to the source, make sure it's right. But I'm sure the WHO, they must have something, I would think. I haven't really studied too much international stuff, so I'm not sure, but maybe Alex or somebody else might know.
Okay, thank you.
Does anybody else want to address that? Any thoughts of
Bonnie-
international data?
Bonnie has a question.
Yeah.
Sure, I can just really quickly just to answer that question, just to add, it's really dependent upon, the WHO can only rely on member nations to report the data, and it really comes down to member countries around the world. We know that China did not report accurately the number of cases. So it really is a country by country issue with respect to international reporting of cases.
But I was gonna say that's very likely the way it works.
And Bonnie, you had a question for us.
Yeah, I did want to ask you, can you hear me?
Yes.
Mm-hmm.
I did want to ask Rebecca, after the invasion of her home, and was she indicted? What's happening? If there's anything you can tell us, or you can't talk about it.
I did have to go back down to Florida. We sued the police, and the day after we had a hearing where the judge was interested in hearing from, he said he was interested in hearing from the district's attorney's office, and that if there was not a good faith intent of prosecuting, then you can't just take stuff forever. And so we were supposed to get with the district attorneys to see if they actually had any intent on prosecution or anything like that. And the next day, the police, not the district attorney, issued an arrest warrant. So I had to drive across the country, very, very ill. I got tested when I got to the jail, and I was COVID positive. Had to stay in the jail. After jail, I went to a hotel to isolate, and for several days before trying to come back home. And I've never been that sick in my whole life. I was afraid to go to a hospital because the room wasn't booked in my name, because I didn't want DeSantis to know where I was. I didn't want the police to know where I was. And if I went to a hospital, there's my ID, here's where I am. And my lawyer kept telling me, like, look, if you need to call 911, you call them. And I was really resistant to that. And I think I had reached the point where I was fever sick enough that I wasn't appreciating the seriousness of it. I mean, we're talking about Alexander Vindman. I like straight up dead cold messaged him on Twitter when I was on fever sick. And I mean, I was so delirious that I literally tweeted to Alexander Vindman that we should shoot the shit sometime, which is not something I would ever do, just cold out of the blue like that. He was really cool about it. He messaged me back. He's like, it's all right. But yeah, I was really fever sick. I didn't know what day it was or where I was half the time. And I say this in all seriousness. I thought the next time I go to sleep, I'm not going to wake up several times. And I couldn't eat anything or drink anything. And it was awful. So yeah, I did have to go back for that. And everything, we'll see what they decide to do. I'm sure the more that I anger them, the harder they'll come. That's how it's been like that for the last year. So I've been kind of trying to relax a bit. I don't do as much press lately, mostly because I was sick when I came back for a while, but tried to spend some time with my family too. So we'll see.
Thank you, Rebecca.
Oh,
Good luck for you.
Oh, indeed. I see the Riot has another question. Riot, you're up.
Thank you. Just want to touch back on Dr. Grayson on the J&J, the Johnson & Johnson vaccine. I know a lot of people are not, because of the efficacy, they're saying it's 50%. And it's not as effective as the other, as Pfizer and Moderna. And the other factor that there's some talk about, and I'm not going to spread anything that is not scientific, but the mercury, because they use mercury because of there's no need for low temperature to preserve. So there's some use of mercury in it. I mean, those are things that out there. Maybe if there's anything you can clarify and to give more input on pushing for the J&J.
Sorry, I'm muted. So first of all, right, the mercury myth is something been pushed by the anti-vaxxers for a very long time. Mercury has not been in vaccines for many, 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 many years. So just dismiss that. The J&J vaccine was 66% effective at preventing moderate COVID-19. So that means if you kind of had like a flu and you stayed at home, it was 100% effective at preventing hospitalizations or death. That is what vaccines are intended to do. And that includes, importantly, and again, you can't compare this, you can't compare the data for J&J to Pfizer, Moderna, because Pfizer, Moderna, we didn't have these new variants. We didn't. The new vaccine, J&J, was tested in South Africa. It was tested in Brazil and the United States. It was tested all around the world. Now, with respect to preventing moderate illness, it was less effective in South Africa and Brazil than the United States. Because why? They have more of the variant. However, in every country it was tested around the world, it was 100% effective. You know, a month after you have that one shot, 100% effective at preventing hospitalization or death. Period. I don't own any stock in any of these companies. Right? What's that?
It's the old technology of vaccines. It's
not. No, it's not actually. So the Moderna Pfizer vaccines work very similarly. They have the mRNA, the genetic material just for the spike protein, packaged up in sort of what we call like a liposome. It's sort of a fatty layer. So it can fuse with your cells. It can get into your cells. The J&J vaccine is also a novel approach. It has a similar approach to deliver that genetic material for the spike protein to your cells, and it turns your cells into vaccine factories, just like Moderna's and Pfizer's. But the way it works is it uses something called an adenovirus, which is like a cold virus from a chimpanzee, to carry that instead of a fat layer that injects the material into your cells. The adenovirus can't infect your cells and like cause sickness or anything like that. It's just a carrier to get that genetic material inside of your cells. The bottom line with all three vaccines is it turns your cells into vaccine factories. Traditional vaccines are things like the old ones. You know, you think about variolation. So smallpox was basically a damaged version of smallpox that was given. Then that turned into something. A flu vaccine is a purified protein, similar to a spike protein, the equivalent on the flu vaccine. That's what's in a flu vaccine. It's made in the laboratory, and then that protein is purified, and a mixture of those proteins is injected. So your cells are not turned into vaccine factories. So one of the reasons why I've always been very, bullish, if you will, excited about the Pfizer, Moderna, J&J types of vaccines is because they're kind of mimicking a viral infection, because they're making your cells make the protein. That's how your immune system would see it if you were naturally infected, but you have levels that are, supra infectious levels, if you will, really, really, really high. So we hyperstimulate that immune system to get immunity. That's how all vaccines work. They just work in a really special way that I think is potentially better for viral illnesses. And certainly, look, the data are impressive for all of them. So again, if you are offered any of these vaccines, take it. They're all wonderful.
Awesome. I'll send it back to my wife. She's one of those. to stop reading the other what's going on out there. Thank you, Doc.
You got it.
Well, this is a chance to very quickly kind of go around the table one more time as to what sorts of action items you might recommend. On my list here, I have get vaccinated, and that I think is true for all of us, and that is get vaccinated as soon as you can, whatever your subset is, with whatever vaccine is available. Just get vaccinated, get it done. I can tell you that I personally have been running down to my nearby Publix and basically at the end of the day saying, does anybody have any leftover vaccine? Do you have? It strikes me that we should have something like in my world, we used to have a standby for airplanes. And any open seat on an airplane that takes off is a wasted seat, right? Well, any drop or any dose of the vaccine that's sitting in a vial at a distribution center when they shut the door is a wasted. Yes. It could be a wasted life. And
Wouldn't
so my
it
thought
be
is
amazing if they just had somebody who was super great at building those kinds of web applications and surveying mechanisms on their website to build a system like that?
Right.
Absolutely, a standby list at every vaccination site. Something that you can say, I'm here, I'm available, I'm standing by. I've filled out my paperwork in advance. And when the day is done, before you throw anything in the garbage, please consider me. It just seems to be such a simple thing to do. We should never waste one dose. If one dose is wasted, it's a damn shame.
Yep.
Anyway, so that's the vaccines. Well, so another thing we were suggesting for everybody that's on this is to please subscribe, be it Florida Today or whatever newspaper. Subscribe electronically. It is incredibly cheap. If not, to get the paper delivered to your home. It is good for our democracy. The Fourth Estate is one of the legs that our democracy stands on. Remember to mask, use social distancing, hand washing, all the things that we all know to do. But many people are so tired and they feel like I don't really need to do that anymore. I've been vaccinated, so I don't need to do it. One of the things I tell anybody, and please, all three of you, if you would like to add to this, that these activities are not for me, and they're not really for you. They're for us. The whole idea of public health is that we do these things. Even once you're vaccinated, you can still carry the virus. The reality is that we do these things because they're for the little kid that's going to school in at the end of the street, or the neighbor or whatever. We wear a mask, we wash our hands, we do social distancing to protect our community. Would you all agree that that's a valid point?
Yes, absolutely. And it also protects yourself. I mean, that's the other thing. It's not just, I think, we progressives tend to be pretty good altruists as well and do think for the common good. But look, for, your perhaps less altruistic or maybe even selfish family members and loved ones, masks protect you. The data are extremely strong. I would call them overwhelming, that a mask will protect your life and prevent you from getting sick. If you do get sick, it'll help prevent you from dying. There's study after study and example after example of this. So wearing a mask literally can save your life.
And Rebecca, Alessandro, do you have any thoughts on the community aspect of this whole experience? Oh, you're both muted.
Community aspect of this whole experience. I mean, I think just from a reporting point of view, and again, this is not a unique experience. It's a lot harder to do source development. It's a lot harder to get a sense of how the community feels. A lot more of reality seems to be virtual, and that can be unhealthy in its own way. So, the newspaper, operates at a different pace from social media, operates at a different pace from real life. And, I think it's important that we just sort of all take a deep breath sometimes and just get in the facts nice and slow.
And Rebecca?
Yeah, I think we've gained and lost different senses of community over the last year. I think we've lost that closeness and that intimacy, but we're checking in more often with people. And I think it's really, really important to remember that we're in the final stretch and everybody wants to hug somebody or go to their neighbors or visit with their friends. And if we want our community to be able to do that, we have to, like the doctor said, please wear a mask, get vaccinated if you're fortunate enough to live in a state that will actually do it. And just take care of yourselves so that we can take care of each other when this is over, because I feel like there's going to be a long period of healing that we need to come out of this, because we're all going to be scarred from it. And I think part of that's taking care of ourselves right now.
Well, Rebecca, I want to give you that as the last word for tonight. I think that all of our speakers will deserve a real round of applause. In just a second, wait a minute. I think we're going to be bringing everybody off mute in just a moment, but I'd like to remind you that our next event essentially is 1 month from now, the first Thursday of the month of April. It's basically Earth Day themed, and it's called A View from the Sky and at Home. Again, hopefully we're going to have one or more astronauts talking about their view from space, as well as an environmental leader who's going to be talking to us about his view right here on the surface. And again, our action items we just talked about, please do something. If you leave this event and just keep it to yourself, we have failed. So I'm asking all of you, everybody that's listening, everybody that's on Facebook Live, everybody that's here on Zoom, when we're done tonight, please talk to somebody else, send an email to somebody, do something to spread the word and inspire somebody to do the right thing, because networking is the key here. We've got to do the right thing. We've got to influence our family members, our relatives, our neighbors. to leave behind the conspiracy theories and go to the truth. Science will win out. Science will protect us, as we have learned from years and years, as does history. If those of you that are not familiar with the story, I encourage you to look up the story about what happened during the Spanish flu epidemic when Philadelphia versus St. Louis, the two major cities, reacted completely differently to the virus that was threatening, and the results were dramatic. And we learned history so we don't repeat it.
Well, Phil, that is spot on. And to see history repeat itself for political reasons, The Great Influenza is a fantastic book. It reads like a science fiction, but it's a true story of the 1918 influenza pandemic. And to watch the exact same mistakes, no masking, false information, manipulation of the media for political reasons. This was in World War I, different reasons, but for true partisan political reasons. And it literally cost lives. The places that didn't heed the advice of the scientists and had the parades welcoming home the soldiers, 2 to 3 weeks later, the bodies piled up in the streets. True story. So it reads, you read that and you say, my God, we really did relive this. And yes, we did. And we didn't have to. And it's an embarrassment. Our country is the biomedical leaders. We are the leaders in the world for biomedical research. And we have been the leaders of COVIDiots under, unfortunately, the Trump reign.
And when the history book is written about this pandemic, I believe that Rebecca Jones, Alessandro Sassoon, and Dr. Dina Grayson will have a place in that book, and we will be proud of you for that. Please, everybody, a round of applause to our speakers, everyone.
Guys. Love you guys.
Honestly, everyone.
Can't wait to see you soon.
Thank you so much. We were very much looking forward to that. Again, to all of our guests, to all of our members, to everyone that has joined us, we'll look forward to seeing you next month. I believe it's April 1st, and that will be View from the Sky and at Home. Thanks to all of you, and we'll be safe. We'll hopefully look forward to seeing all of you next month. Thank you.
Thank you.
Thank you,
guys.
Be safe, everybody. Much love.